Friday, Baylor College of Medicine and Friends of Baylor. Well, what a special day today. We are shooting in the DeBakey Museum, and over my left and right shoulder is the original operating room for Dr. DeBakey's open hearts. And I just want to, it's very complicated, but I want to show the most important part of the entire apparatus, the orange extension cord. Who knew it took an invention like the extension cord to make open heart surgery happen? Anyway, let's talk about my most favorite topic, measles. I'm so sick of measles. We gotta get over this. But anyway, we've been up to 1,001 cases as of May 8th, 13% hospitalized, 3 deaths. And this was the weekly measles cases by rash onset. So you can see a huge spike in this past year. And we're slowly approaching the 2019 number. We're at 1,001. Back then it was 1,274. And I've shown this a couple of times. It's saying true to what's been happening. Most of the outbreaks are in states that were under-vaccinated, under 94%. In Texas, we're up to 717, so 8 new cases just in the past week. And same distribution, and all related to that one place in West Texas. We've had a total of 717 cases, an increase of 8 since last week. 92 patients have been hospitalized, and again, 96% of those are unvaccinated. So there is one really interesting paper that came out in Public Health from our fantastic group, Tony Moresso's group, looking at the wastewater. I've been reporting all along that wastewater has been sort of, since the pandemic, has been the new way to look. And our group has pioneered shotgun sequencing of everything in wastewater to look at viruses. Well, they did an interesting study that was recently published that looked at the 2 cases in Houston that showed up. And what they found was they were able, about 2 weeks in advance, to detect measles in the wastewater of one particular area where these 2 people lived, before they actually presented with the rash and the disease. So it's really kind of amazing. 2 weeks in advance, they were able to detect, and all the other wastewater analyses, the other several hundred, I think it was 100 samples, were negative in Houston. No longer detecting, so we probably don't have any cases in Houston, but once again shows an amazing new technology developed here at Baylor by Dr. Moresso's team to be able to look at future pandemics and infections. So congratulations to Dr. Moresso and his group. As for respiratory virus season is sort of finally coming to an end. You can see the red dots, this line for this year. Here are the other seasons in 23, 22, 21. But you can see we're well below the usual reporting for upper respiratory diseases. So it looks like we're finally out of that season, just in time for hurricane season. It's always something in Houston. And new influenza cases are down quite a bit. There's still some lingering ones from age of 65. And as I said last week, I'll just show you the data again. This was a pretty bad season for mortality in flu, higher than usual, and particularly bad in the pediatric population. Here's the pediatric mortality. You can see this year was pretty bad, and we had over 200 deaths, which is really a shame, and it was because the vaccination rate was so low. We fell under 50% for children's vaccines. COVID is low. We still have a couple of friends who have COVID. Amazingly enough, it's still around, but it's quite low. And if you look at wastewater activity, it's, again, low but present. So you can detect it, but it's present. And I wanted to catch you up a little bit on what's happened with COVID, because it'll change, or it'll have an impact on what we do and what I recommend in the fall. So if you look at the dominant variant now that's in wastewater that we can detect is LP 8.1. And I'll show you what that means in a second. This is the Travelers program, which looks at pooled samples from airplanes and airports. And you can see there's sort of a little trend upward. So international travelers are still coming in with COVID. And the interesting thing is the predominant variant with them is not LP8, but this B1.1. So what does all that mean? Well, let me pull out our evolution diagram, because it really is fascinating to me. If you recall, back in 2022, Omicron was the dominant strain. And then the dominant strain in 2023 was this JN.1, and then the dominant strain in 2024 were those flirt variants, that were mutations in all these K strains. So you can see there's evolution over time that on this lineage. In the Travelers program that I just mentioned, the B1.1, is a very old, original lineage. So this it shows you how what's going on in the United States is not necessarily what's going on elsewhere. And that's why a recombinant variant or something that happens internationally can suddenly change the dynamic. But the current strain, LP8.1, is just a slight variation from these strains. And why that's important is it's not a major change. And so the vaccines that you had before, or if you had a recent infection, you should be pretty much protected. It hasn't had a giant recombination where we'll all be susceptible again. So I have a feeling just a standard booster in the fall will be probably fine. But again, I will let you know what's happening in terms of evolution of the virus. And there was one other really interesting paper I wanted to talk about. I mentioned, I think it was last week, that there was a real interesting study from Wales that if you had a shingles vaccine, the people who were vaccinated had less dementia, less progression to dementia. And there's a whole new thing around some of the determinants of people who have memory loss or neurodegeneration, that it might be an inflammatory response. Well, this was a similar study looking at risk of heart disease, and it turns out shingles vaccine reduced heart disease by 23% in a study of 1 million people. So this concept that your inflammatory state in your body has multiple impacts. It could affect your heart, it can affect your brain, and even your pulmonary function, your lungs. And so this is a really kind of new area of study that's going to, I think, have a lot of implication for many diseases. And again, I will let you know as the new research comes out. So I want to end today with a bunch of shout-outs. First of all, the Gold Humanism Society. Each year, Baylor College of Medicine inducts medical students into the local chapter of the Gold Humanism Society, which is an international organization that recognizes and supports the value of humanism in professionals in medicine. So it's trying to remind physicians that the humanistic approach is very important. We had 32 students who were inducted this year, so congratulations to them. Also, a big shout out to the first and second year medical students on our Temple campus who were honored by the City of Temple. The mayor, Tim Davis, had a proclamation that rewarded them for their community service. And since the campus opened in July of 2023, our students have given over 2,500 hours of volunteer service for Temple non-for-profit organization. So thanks to all of our Temple students for doing that, and thank you to the mayor for recognizing it.
We do have the wherewithal sometimes to do great big things that impact everybody.
Just something really important happened this past week. The Texas legislature voted to establish what's going to be called the Dementia Prevention and Research Institute of Texas, or DPRIT, for the prevention and treatment of dementia, Alzheimer's, Parkinson's disease, and related disorders. So just like CPRIT, which is the Cancer Prevention Research Institute of Texas, this promises to have a huge impact on the state of Texas research in trying to combat neurodegenerative disease. And within that context, I want to really thank Dr. Christian Lasagna Reeves in neurology, who went up to the legislature and testified and was one of the real proponents of why we should have DPRIT. And a big shout out to Senator Huffman and Lieutenant Governor Patrick for making this a high agenda. This is one of the most important legislative things you can do to support research in our state. And then finally, a big thank you to the Nolan Ryan Foundation for their $2 million gift to support groundbreaking work in skin cancer. Dr. Ida Rango, Chairman of the Department of Dermatology, will lead this work. Really important work, and thank you to Nolan Ryan, great pitcher for doing that. So have a wonderful weekend, and I can't wait to see you next week.